very much, Shomi, my colleague and my boss. He's now the director of the Institute of Genomic Medicine where I belong to. So today I'm going to talk about whole genome sequence data for the undiagnosed disease. I'm going to focus on rare disease. So we'll go coming back to rare disease, which is easier. I will only take something easier. And with reference to the rare disease, we are beginning to form Taiwan Rare Disease Network. This is a project in progress, just to let you know what's going on. So this is my outline. So since I'm the newly appointed director for the research planning and development, so I will share with you what NHRI about, in particular for the visitors, National Health Research Institute. And because of this institute, I have the opportunity to apply and operate this flagship program. She's not here. I can fully understand. Okay, I can fully understand all the procedure that is required to get the budget, and then they begin, even before you get a budget, they ask you to get a product in 5 years. I know the joy and the pain for doing this kind of work. Okay, I think the key point here is the whole genome sequencing for diagnosis of rare disease is quite mature, I think, but it still requires some work. It provides what I call is a low-hanging fruit for genetic study, and I maybe share with you where are we heading to. Okay, so these are the outline. So this is a beautiful campus for NHRI. We really have to thank Dr. Ken Wu. I hope and I'm confident you'll recover well. He has a full rigor to fight with any difficulty, okay, physically and mentally. Okay. So this is the campus. Is the NHRI established some 21 years ago, and we moved to the current location in Hsinchu 2004. NHRI have made impact and built infrastructure for Taiwan. The current location strategically located in the Hsinchu Science Area Park. I'm so happy to show Chess, my dear friend, Dr. Brenda, around in this neighborhood. So this is about 100 kilometers south of Taipei. And there are many university, research institute, and industry, in particular semiconductor industry in this area. So we take advantage of this location, strategic location. We can find multidisciplinary interaction to promote research. NHRI does not work alone. We have been engaging with many hospitals, medical centers throughout Taiwan. Importantly, NHRI is a think tank for the government. So we have established oncology cooperative group. We have provided the basic data for the medical insurance, the claim data, so that get an estimate of how this healthcare system, the resources are used. Taiwan surveillance of antimicrobial resistance T-SAR, for short, is a 20 years old surveillance program to monitor drug-resistant bacterial infection in Taiwan. Of course, NHRI Forum played an important role to sponsor this program of this meeting. So our vision is to enhance the health and well-being of the people here in Taiwan, and we try to establish NHRI as an international biomedical research hub and center for excellence in Asia through international interaction and collaboration, like people here and the conference to promote collaboration. And we would like to coordinate the high-tech cluster in Taiwan, taking a realistic approach. Right. So this is the website for NHRI. That's the first part about NHRI. Last year, we got the opportunity to apply for this flagship. You really have to jump on the ship at the right occasion. So we were on. So starting this year, 2017, will be a 4-year program to support this so-called flagship program. And thanks to Professor Chuck Freeman, he helped me to coin the term, very good one, precision medicine for Asia Pacific Biomedical Silicon Valley. Remember, we are located in the IT cluster area of Taiwan, and we want to build on top biomedicine. So that's we have a vision to excel or be successful in Asia Pacific realm. And this program is jointly operated by two Ministry of Science and Technology, MOSD, and Ministry of Health and Welfare, which provide the funding to National Health Research Institute, which is an organization, a non-governmental organization. So these two ministries proposed the program operated by NHRI. There are two research units, including our IMGM, Institute of Molecular Genomic Medicine. Professor Shih-Feng is the current director, and also jointly by NHRI Forum. In the beginning, we proposed 5 endpoints. I think the government official is right. They don't want papers or science nature. Of course, it's important, but equally important, I think, is to have something that is deliverable. So these are the 5 important aims we set up. So that's on the top of, on the upper part of this slide. These are more foundation building, like 3-generation birth cohort. We want to learn from our dear friends from Japan, and also we want to establish molecular diagnostic and registry system for rare genetic disease disorder. This is the main topic of today. I think it's important to put together all the genetic and health information together using the digital form and set up a system that everyone can use and benefit from. The government really wants this. Okay? So in order to deliver and to achieve this goal, we have successfully helped facilitate and establish a Taiwan Genomic Industry Alliance, TGIA for short. So these alliances can collectively invest and manage new technology, and also we establish a new company to deliver product and services. All right, so I think this is the main goal for the flagship program. Our strategy is to incorporate precision medicine, PM, and learning health research to have 2 models working, and thanks to Shih-Feng and I forget maybe Christine Chen draw this stuff nicely. So on the one hand, we have the technology, wonderful technology of genomic precision medicine concept, but we need to incorporate this learning health system idea. Whatever we want to do with this technology, we want to help. I think this is the important part. We want to continuously to improve, to analyze, interpret, and make adjustment, and to use either targeted screening or personalized treatment. One important measure is we want to know whether this anything we have done here will help and optimize the benefit of the patient, including quality of life and clinical outcome. Something we can measure. Okay. All right. Learning health system, I will not spend too much time because the real expert, Professor Chuck Freeman and also Evan will talk about it tomorrow. All right. So, but it's important to identify partner medical center to work with us. Of course, internationally we have the North Shore medical research centers. And locally, we have the hospital, Taipei Medical University Hospital System, and also the Chi-Mei Hospital System in the south. I'm grateful to Dr. Lin Xiujun from Chi-Mei to help me. Maybe a joke. I talked to chair that chairs about Chi-Mei. I personally said, it must be difficult for chairs to appreciate what is Chi-Mei. So he said, no problem. Chi-Mei is my favorite Belgian beer, right? So I do know the Chi-Mei beer. Okay. Rob, do you know about Chi-Mei beer?
No.
Yeah, I will buy one bottle for you. Very nice.
What do you want?
Okay. It's available. Okay. These are the vision. We want to emulate, become a top precision medicine program in Asia. We don't think there are so many good ones. We hope to assemble a good one for Taiwan. And also we want to be a global leader for living health system. That's the vision that's shared by Chuck Freeman. Okay. Internationally, we will collaborate with many outstanding organizations such as ToMMo, North Shore, and Michigan, and others. So that's the second part about flagship. So from NHRI, which is a nationwide research engine to promote the overall research, biomedical research development. And we have this opportunity in the next 4 years to build basic infrastructure by precision medicine learning health system. The aim is to benefit people and also to build industry. So now that into human genetics, which is my true love. Okay. So I want to share you beginning with a case. Okay. This case was referred to me. I'm not a doctor, but a genetic challenge to me from my good friend Dr. Lin. She worked as one of the big Lincoln Union. Dr. Lin took care of this baby, which was deceased 2 years ago. And this baby girl presented with difficulty of intestine, like inflammatory bowel syndrome, which occurred right at birth, and also has infection. Because Dr. Lin has very good relationship supporting this family. So when the mom has the second baby, she moved to Changhua in the central part of Taiwan. She let Dr. Lin knew about the coming of the new baby, and very soon this new baby suffered from the same symptom as this deceased elder sister. So Dr. Lin moved this baby to Lincoln, and I was asked to whether I can help. There's no diagnosis whatsoever for this disease. So end up this disease is a gastrointestinal defect and immunodeficiency syndrome, GIDID. There are less than 12 patients in the world. So no one, the doctor have never seen this patient before. So for a geneticist, we know it's autosomal recessive disease. And since the parents are healthy and unrelated, we assume this might be what we call a compound heterozygous mutation, i.e. The mom and dad each carry a mutation mutant allele on the same gene. And unfortunately, these two young couple, they married. So that's the scenario, genetic. We took the challenge, so before we send this sample for analysis, we have outlined a framework. I like the word framework. You really have to think along what do you want to look for, otherwise you're just chasing the rabbit or in the wrong way. So of course we'll get the whole genome sequence for the two sisters. So the DNA from the first baby will have some remaining DNA we can take out from the freezer, and the second one from the blood sample. So we actually did two whole genome sequence for those two sisters, and one for the whole exome sequence. Turned out the quality of whole exome sequence was terrible, so, and the whole genome. So I'm a strong believer in whole genome sequence rather than whole exome sequence. So we train out the low quality and we map to the reference and we look for the heterogeneous mutation, and on the basis that this will be a compound heterozygous mutation. In the interest of time, I will just run through this. This is the depth of the average sequence, and we look for a heterozygous variant, and it's deleterious. And it ends up 14 allele occur in 10 gene. So that's pretty good. So we consult very important resources that is OMI. Okay, these are the name of the 10 genes. Okay. The one that found interesting and we think is the right answer is the gene TTC7A of chromosome 2P, and the disease phenotype is a gastrointestinal defect and immunodeficiency syndrome, autosomal recessive. The mutations, one is a glutamine acid colon 75 trend from acidic to basic, and the other is a two-base deletion. So both are obviously deleterious. Right. So we confirm that this single-base mutation came from mom. That is okay, and the two sisters each carry this mutant allele from mother. On the other hand, the two-base deletion came from dad. Mom is wild-type sequence, and the two baby girl has the same one. Okay. So this we confirm by single sequencing. So, these are two allele for mutant allele. That's one. Importantly, we would like to know why this mutation of TTC7A will cause symptoms of the GI tract and also the developing Alzheimer's. So we get connect with through Facebook to one of the parents who is a strong supporter for this rare disease. Andrew Miller is the name. He lived in Cincinnati, so I communicated with him. So he actually explained to me that he's the parents of this rare disease. He said because of this defect in TTC7A, is the ROCK kinase shoot up, and this ROCK kinase will affect cell plurality. So the cell will be in the GI architecture will be inside out and upside down. So that made me understand, explained by a non-scientist about what's going on in cell biology, because he spent more time and effort. Actually, he's more knowledgeable than I do. And also he suggests to me that not only hematopoietic stem cell transplantation alone probably would not cure this disease. And this is the sinus, and this is the control, and this is the patient. So that's the first case. And I actually talked to June, tried to get the medicine for that. Unfortunately, we couldn't get the medicine. If you're interested, I can tell you more about the story. Okay. The second baby. So we worked with this pediatric immunology. So he was so impressed. So he get all the immunodeficiency patients, and he asked our team to do the second case. So this is a boy born from this lady of his second marriage, this 1 year old, and this boy has repeatedly pneumococcus infection and other bacterial infection. We have only one case. We're not so sure whether that's a genetic, but we sequence whole genome anyway. The important phenotype, the most outstanding one is there is a high CD4-CD8 ratio. In other words, the CD4-8 is very low. This is the normal range. This is the in this boy. CD4 is normal, so the ratio of CD4 to CD8 is quite high. So that's the obvious laboratory feature. Same as this one, CD8 is quite low. Right. And the immunoglobulin, immunoglobulin level is low, but IgE is very high. Again, we send this one sample to Marcogene. I know some people doesn't like Marcogene, but we use it anyway for the sake of convenience. This is our logic and workflow. We assume because these parents are Taiwan origin, okay, we assume they maybe share the same mutant allele. So we look for homozygous, heterozygous mutation. This is the workflow. Of course, we have to consult all these immunodeficiency database, and we remove barriers in NHRI. That was the outline. Okay. The average length of coverage is about 34 or slightly less. All right. This is the answer we think is the correct one. It's affect a gene called ZEP70. Is on which chromosome I can see, but it causes a homozygous mutation. And this allele, which is quite rare, 1 in 121,000, even in so in homozygous it will be quite unusual. Okay. We were not sure about whether that's the right one, but the ZEP70 gene encode tyrosine kinase. That is a critical T cell signaling molecule. We'll show that in the next slide. So it's on chromosome 2p, and this disease mutation of this gene ZEP70 will cause combined immunodeficiency. ZEP70 expressed in the developing lymphocyte. It is critical for this decision. During the sinus development, the T cell have double positive stage, turning from CD4 positive, CD8 positive to either CD4 positive or CD8 positive. In other words, this is an important step to make a selection. So when there is a defect in this, that can explain why the CD4-CD8 ratio just went wrong. Okay. I was a little bit concerned, even this makes sense to locate on the position 301 is the right position on the kinase domain. So we consult the expert whether this residue change here from a colon position 5 to 1 from asparticase to asparagine, whether that would have an effect. And the experts, Dr. Huang Mingjing in IBMS, he told me that this residue is indeed important. It will disrupt the forming the hydrogen bond with these two basic residues, therefore disrupt this very important activation loop for the kinase. So structurally we can explain and function. So that's the second case. We were quite happy when we started the first two. We maybe God would like to give us more confidence to do this kind of genetic exercise. This one is very interesting. This lady, she's 55 years old now. The disease occurred to her 2 or 3 years ago. And this is a patient with early onset dementia. So the age come up at 52. This Alice has a brother, Andrew, living in Hong Kong. Living in Flushing, Queens. And her mom and this should be deceased. Okay. So the gene obviously came from this autosomal dominant inheritance. So the question here is, I met Andrew's husband, Paul Shi. He is a very decent gentleman from Hong Kong. They both work in a bank. Alice was fired because she wasn't behaved normally. She has social, abnormal social behavior. He would run away from the customers and so on. And actually I interviewed Alice and see her. And it's really difficult for Paul to look after her. Alice is originally from Taiwan, so she flew back to Taiwan for regular neurological follow-up in Hualien, City. Okay. Paul is very concerned. She knows there's little hope that there's a little chance that Alice will get cured. But he's concerned about his two sons and about this the brother-in-law, 52 years old, Anthony. So originally my idea is to get DNA whole genome sequence for this one, and we'll find out common deleterious mutations and to confirm that okay. And we'll do this. But I have trouble. I have to travel to New York, try to get this DNA. But the data came back. And again, this is our analysis workflow. We want to compare with the conventional mutation, look for a simple non-synonymous variant. And using this logical thinking, and we found one gene we think can explain this disease condition. There is a protein called MAPT, microtubule associated protein tau. And actually, my fellow, Dr. Lin Yongfeng, he did all these 3 cases. He is quite good. He consulted this database, Alzheimer's disease and frontotemporal dementia, FTP, is a disease. And by checking at this position, protein 301 mutation, it has a clear document that worldwide there are 22 families affected with this particular mutation. And the average onset is 52, right on the spot, amazing. And the mean age at death is 59. So that said, Alice maybe would live another 2 or 3 years with it, unless something miracle happen. Okay, so that's what we found for the 3rd case, which is autosomal dominant. The mutation occurs in position 301. This disease is very well documented for MAPT. Mutation of MAPT will affect a neuron, a spinal neuron called from econormal neuron. It's the longest neuron in the brain, and this neuron is particularly enriched in higher mammal or higher primate. And the only animal that is known to have this VEN from econormal spinal neuron is elephant and dolphin, two animals that tend to socialize. So that there's interesting biology associated with this. So these are the three possible mechanisms for dementia. So because of our exercise and practice with this using whole genome sequencing for rare disease, we were encouraged by our capacity to use whole genome sequencing. So we form an alliance with these two groups. One is the Taiwan Foundation for Rare Disorder. These are the NGO organization owned by the parents. This is a patient advocate, so they will support our project, and they're going to contribute 1/3 of the budget that is required. So same is like chest share with ideas, rich brain who has prostate cancer is, for the first is quite different and it's manageable. And mostly rich, wealthy men, okay, with a good heart. But anyway, we also collaborate with Professional Society, Taiwan Human Genetics Society, and international will collaborate with Professor Wang later. The next few slides I will share with you how this whole genome sequencing can help. This is what we call a diagnostic odyssey. If we don't have any good test, this patient will be sent from laboratory to laboratory, going through all the tests without a clear diagnosis. This is 2015 International Diagnostic Criteria by Molecular Diagnosis. Just run through this. See how difficult it is. You have to run through all these steps. Okay. 7 categories. You have to do one by one. First, so now we have this organization, Taiwan Rare Disease Network. So we are able to collaborate with the professional society. So these are doctors, hospitals. They are contributing their sample to work with us. Fortunately, our new machine arrived last month, and hopefully will provide sufficient capacity. And we will do this genetic model after the UDN of the United States. Again, I think I will refresh that this is one of the important milestones. I think we are in pretty good shape. I think this is going to be a long shot, but we'll start with something easy here. And in the long term, we hope we can build a system so that in the greater Hsinchu area will become a hub for product design and manufacture for precision medicine, product development center for precision medicine. And I acknowledge the patient, the doctors, and my laboratory members for this work. So I'll stop here if there's any question or comment. Thank you.